Hi, my name is Sarah Patterson and this is my Ejv Osce. So before I start this cannulation, I would just gain consent from my patient if they were conscious. I would also ask them if they had any allergies and I would explain the procedure to them. Once that is done, I'll say that I'm wearing my personal protection equipment, so I've got my gloves and my goggles on and I've got all my necessary equipment ready for a safe cannulation. So I got my sharps container, my gauze, my alcohol swab, my luer plug, my tegaderm, my 10 mils of sodium chloride flush, which has been drug checked by me and my crew partner, and my cannula, which is attached to 3 mils of sodium chloride. So the reason I would attach it to 3 mils of sodium chloride is to prevent air embolism and pneumothorax due to the venturi effect. With the cannula, today I'll be using a 20 gauge just for this assessment, but in real life scenarios you would use a 14 to 16 gauge. So the 3 mils has also been drug checked by me and my crew partner. So once that is done, I would engorge the veins. So what I would get the patient to do if they were conscious is lie down in the supine position with their legs elevated. I would ask them to bear down as if they were going to the toilet, or I would put pressure on their liver. So once that is done, I would position the head laterally, so away from where I want to cannulate. I've also put a towel underneath the patient's head for comfort in case they were conscious. So if the patient was conscious, right now you would just inform them with what was about to happen. So I'd pick my injection site, get out my alcohol swab, and start in little motions, circular motions going outwards. This is to prevent dirt from going into the site where we want to cannulate. So once that is done, I'm happy that it's now sterile and clean. So I would just warn everyone, so my crew partner, the patient, anyone that might be around, that sharps it out. So I'm going to tamponade the vein, going in at 15 degrees. And I now aspirate. So I'm happy that I've got flashback, so I know I'm in the vein. Now I'm going to flatten the needle and advance 2 more millimeters. So now take this off. Tamponade again before removing this. Once that is done, I'll get my luer plug out and put that on. So now I would get out a bit of tape and just secure it. So now is the time that I would document the time, the date, route location, and the cannula size in which I used. So now what I'm going to do is I'm going to get my flush out. So this has already been drug checked and I've already gotten rid of all the air bubbles in it. So I will be giving 5 mils of sodium chloride. So just slowly administering it. So the reason I'm flushing is just to check for infiltration and patency of the IV. So that's 5 mils. Putting the cap back on and just putting that in a sharps container as well. So now that the flush is in, I am now happy to secure it with my tegaderm. So now I'm just going to put this on the side, and that's where I would document the date and time. So now I'm happy that we've got a nice secure IV, and yeah, thank you.